I'm Peter Block with a Cardiosaurus Heart Minute, and today I'm with Dr. Chris Cannon from the Brigham and Women's Hospital. Chris and I are talking over some of the late-breaking reports that have come out in the last couple of weeks in the literature. Chris, the RIFLE-ACS trial, interesting trial, but the RIFLE-ACS tried to figure out whether an acute myocardial infarction, radial access for an interventionalist is or is not better than the sort of traditional femoral access. Bottom line is that in this study, the radial access won. So give me your thoughts about this. It's a tricky area. It's very technical, isn't it? And it's a little hard to know exactly how all of this fits together. What's your take?
Well, the advantage has been largely less bleeding seen in an unselected elective population. And this study nicely looks at STEMI, where everything is urgent and done very quickly. So it's nice to see that that holds up in a randomized trial. But these are also the sickest patients, so it makes me a little nervous to say you have to do it radially, and I'd kind of like to have the interventionalists be comfortable with whatever they're doing.
Yeah, I agree, Chris. I think that if you're an interventionalist, and let's go back to the trial just for a second, because it's interesting. In the trial, if somebody needed an intra-aortic balloon pump, for example, they got their pump first from the femoral, and then they went back and did a radial, which seems a little bit backwards to me, because if you're ready in the groin, you may as well just go to the other side. I think your point is a good one, that yes, there's no question that the radial access gives us less bleeding, and in a trial, in a composite endpoint, that's going to come out ahead. There's no question about that. And bleeding, we know, is not a good actor long-term, regardless. But if you're uncomfortable in any way with the radial site, or if you know that the patient is hemodynamically a little bit unpleasantly unstable, and you may have to do double wires or triple wires, or put a balloon pump in, or bail out some way, the femoral is still, in some cases, I think, a reasonable way to go. So perhaps the message here is be comfortable with what you choose and choose well.